My topic on
Hi guys,
neurological
today to
disorders
everyone on my
continues.
TikTok page. I will be continuing my topic on neurological disorders. I would like to firstly talk about functional neurological disorders. Now, functional neurological disorders can be characterized as an unexplained neurological system that does not cause structural or organic damage to the nervous system. Now, some people who experience or who are diagnosed with functional neurological disorders can experience impairment with their physical mobility. Some of them will also experience non-epilepsy seizures and also psychogenic. Okay? Now, some of the causes of functional neurological disorders can be physiological or psychological. It can be trauma or stress related. I would also like to talk about other neurological disorders. Some of them are Tourette syndrome. Now, Tourette syndrome are sudden repetitive involuntary movements like tics. Like when some individuals are diagnosed with Tourette syndromes, they will be having involuntary movements. So basically, sometimes they will be just saying words involuntarily or doing things repetitively, okay? Like tics, they call them tics. Other neurological disorders are cerebral palsy. Cerebral palsy fit under the category of different neurological disorders. Muscle tone. Then we have Bell's palsy, which causes paralysis in the facial muscle. Then it have also stroke. There are two different types of stroke. There are ischemic stroke, which is a blockage to the arteries. Then there is hemorrhagic stroke, which is the blood flow to the brain has been interrupted. Then we also have more neurological disorders like seizures, which are more epilepsy based. Now with epilepsy, the electrical in the brain is abnormality. Then we have others like autism spectrum disorder. Then we have Parkinson's disease. I spoke about Parkinson's disease yesterday. Then, you know, it have lots more numerous neurological disorders, and as time goes by, I will be talking about some of them. Okay, now individuals who are diagnosed with these said neurological disorders, they're going to have impairment and deficit and dysfunction in cognitive to mobility to trying to complete their daily task. Now, some of these neurological functions may affect one's nervous system. The nervous system is compromised. The nervous system is the brain and the spinal cord, and then we have the peripheral nerves, which is the nerve branches outside of the brain and the spinal cord, right? So some of these neurological disorders, some of them might be the nervous system, a dysfunction with the nervous system, or a dysfunction with the peripheral nerves, okay? And some of them, some of the interventions or some of the multidisciplinary approach will be assigned a neurologist, a neurosurgeon, or assigned a course of seeking recreational therapy. Okay, so as I said yesterday, I'm trying to bring awareness to people in society to know that some individuals will be diagnosed with neurological disorders, and we as a society, as people with